and I guess my first question to Alex is going to be: is it safe for me to be running?
Yeah, and I think that's probably the biggest question people ask or get asked by friends and family when you say you're running. The common things are, aren't you worried about hips, knees? You're going to get arthritis, going to wear things out. I think the short answer to your question is yes, it is safe to be running. I think there are definitely some caveats to think about, which we can delve into. But in short, it is safe to be running. It's a good exercise. It has been shown to be beneficial on sort of multiple levels. All cause mortality is lower in those that run regularly. Things like heart disease, diabetes, cancers are lower in people that run regularly. So it has huge health benefits. And then the thing that I'm sure you're probably more leaning towards is it going to wear my joints out or things like that, which is the common question. So, and I think over the last decade or so, maybe a bit longer, we've had more and more research emerge that means we can really quite confidently say at this stage that actually those that run on the whole have healthier joints and less arthritis than those that don't run, basically. So particularly looking at hips and knees, we see there's been some good research where they do prospective studies where they follow people over decades of life, and then they x-ray and look for radiographic x-ray signs of arthritis. And they would, on the whole, runners will have about half as much arthritis in knees and hips as sedentary people that don't run. It is, as we were talking about earlier, a U-shaped curve though. So you've got the regular runner like yourself who will have, on the whole, less arthritis. We're not saying no arthritis, but it will be less prevalent, versus a sedentary runner who will have more arthritis. And at the other end of the U, the incredibly high intensity or high amounts of running. So runners that run large amounts or run lots and lots of high intensity. So more elite level runners, or potentially level runners, will have higher levels of arthritis than the sort of recreational runner. So yeah, fairly long answer, but the short answer is you are safe to be running.
Okay. And as you know, as a physio, I read the same research, but it'd be really useful, I think, just to explain, if you like, the science and the physiology under those numbers, because it is counterintuitive. We're talking about osteoarthritis, which is essentially wear and tear. So if I'm jogging, surely
Yeah.
I'm creating more wear and tear on my joints. So the intuitive thought would be the more I run, the more wear and tear I'm going to get.
Yeah, it would. And I think that's where societally and anecdotally all those stories have come from. And it's easy to correlate if you've got a bunch of people who are maybe in their 60s and 70s and 80s sat around talking, and some of them have got arthritis and some of them say, oh, well, I used to run a lot. It's easy to potentially draw that line from A to B and say, well, it must have been the running when you were younger that means you've now got arthritis. But we know arthritis is a very complex subject, and the science on that is getting better and better. Um, and it will have you'll have genetic predisposition. Environmental factors will be a trigger. How you live your life, lifestyle, nutrition, exercise levels will absolutely be a factor. With running, the thought process is that yes, running is a mechanical load on the musculoskeletal system. So that includes the joints. But done at a sensible level and done at a regular, consistent level, it has positive mechanical effects on the joint. So it encourages chondral bone to regenerate and to become healthier and thicker. So runners generally have healthier chondral bone, and it's chondral bone that breaks down in arthritis essentially. So actually that mechanical load done consistently can act as a real stimulation for healthier chondral bone, more sort of regularly produced synovial fluid, all the things that actually keep joints in a more healthy state than someone who is sedentary and isn't giving that mechanical stimulus to their joint anywhere near. And you have to also remember that if I'm a runner and you're a runner, you're choosing to run regularly, there is a link, there is a corollary with that you also probably live a healthier lifestyle than someone who runs regularly. You would hope.
One would hope so.
So you probably eat a bit better.
Yeah.
You probably make better decisions about sleep and nutrition.